We'll also be looking at local learning through Audit and touching on some of the future work that we'll be doing around our audit work as well. We will be looking at our MACE and BeAware and our partnership intelligence. We'll be focusing on ICON, which is around infant crying. And then finally, we'll be touching on our hidden harm, which is a current campaign that we are working on in light of the current COVID-19 pandemic. So I can see the numbers of individuals coming into the session is growing as we speak. We're expecting around 80 individuals to join us today. So what I would like to do is take you through a journey around our safeguarding practice review, and I'd like to touch on a few cases that we have reviewed as a partnership. During the pandemic, we've received 5 notifications into the Safeguarding Practice Review group. I won't have time to touch on all of those, but I'd like just to touch on a couple of the cases and share with you some of the multi-agency learning that we've identified. I think it's important to say that during the COVID-19 pandemic, we have seen a number of cases come to our attention that are in regard to non-accidental injury within babies. We've also seen through our child death notifications an increase in drug-related deaths, and that's primarily within the teenage year cohort, and our younger end around sudden and unexpected death in infancy, and connected with that around safe sleeping arrangements for very young children. I think it's important as well to note that we will touch on a few cases, but really want to champion and celebrate the fantastic work that does happen across North Yorkshire each and every day. We will focus on a small number of cases where we've identified multi-agency learning, but not taking away the fantastic work on hundreds and thousands of cases that do happen across North Yorkshire. If you do have any questions throughout the presentation, I'd just ask you to put those into the chat, and Natalie will, our glamorous assistant, will be able to feed those questions back to us after each of our sessions. So what I'd like to do now is talk about Child A. So Child A is a 16-year-old boy who is or was subject to child criminal exploitation. There was a number of agencies working with this individual and to try and help and support and meet his needs. Sadly, despite this engagement and involvement, this child died from a drug overdose alone within an adult hostel. I'd just like to touch on some of the learning points that we've identified through our reviews. And I think it's really important that we start off with frontline practitioners being alert to the signs of exploitation and understanding how the control of exploiters can have such a great pressure and control over a child or young person. And for us as professionals, we need to be aware of these signs, and most importantly, how to support and how to make sure the right help is at the right time by the right individual working with these individuals. I'll come on to how you can look at the signs and what you need to do a little bit later. Also within this case, the involvement of parents, and we need to be mindful that a number of parents who child has been exploited through criminal exploitation or sexual exploitation feel powerless. They feel that the abuse is happening outside of the family home, and sometimes what we need to remember is that partners parents can be a supportive partner to the professionals working with those children and young people in their care. Also be mindful of the services that are available for parents. So we have through our Police and Crime Commissioner's Office commission services such as PACE, which is Parents Against Child Exploitation, who can provide support for individuals and an offset where they can meet with other like-minded parents who've been in a similar situation. We also need to make sure that action plans are fully utilised, that they take the voice of the child, but also importantly, take the voice of the parent, making sure that we are focusing on that individual and making sure that those action plans are multi-agency, and that people who are working with that family unit are aware of the safety plans and the actions that need to happen to try and make this individual safe. Where young people are being exploited and groomed, workers need to be encouraged and alert to the behaviours of the groomer. So understanding from the child, if it's possible, or from other organisations, how this child has been groomed, how they are held to account by the groomers, how they'll probably be coerced and controlled and told not to divulge any information, and generally due to threats of life, threats of injury, and a variety of other threats that will be given to those individuals. Also, we need to look at where young people may feel suicidal or report suicidal ideation in terms of what support is available for them. And within this particular case, we noted that the accommodation was an adult hostel, and we just need to be working with our partners to make sure that the young people get the most suitable accommodation for their needs and age. And again, I appreciate accommodation is sparse, but we need to be making sure we're asking those right questions of organisations. I'd like to draw your attention to the BeAware Knowledge Hub, which is the logo you can see on our website on the slides. It's a knowledge hub based on our website. It provides a variety of information at your fingertips, looking at signs and symptoms of exploitation, where to go for help, what services are commissioned in North Yorkshire, and there is a link to that within the slide set chat bar today. I'd like to move on to child B, which is our next child of a possible non-accidental injury. So this child B is 4 days old. It was reported to have a floppy arm. When undertaking sort of the medical child protection medical assessment, they found that the child had a fractured arm, a fractured skull, and bleeding to the brain. Where in terms of the learning that we've identified for this particular case, we would like to, and appreciate this will be for probably more health professionals that are on the call today, liaison between mental health services and midwifery is a vital important aspect to ensure that we are managing the risk of this individual or future individuals, and also liaison between midwifery and obstetrics within the hospital itself, making sure that information and records are up to date and communication is between different departments. We need to look at how we capture information from partners in terms of the partner of the mum. So when we're working with dads or other significant members of the home, making sure that professionals are aware who is in that support bubble, who is able to help and provide that much needed support at that time of delivery and going forward. There's an element, and again, we see this time and time again, of making sure that documentation and reporting is in place so that we can ensure robust audit trails, and also where we're sharing information between different agencies, that is most up to date and recent. And then finally, in the importance of undressing and handling babies, and we've seen, I think, some practice has now changed as a result of some of the learning where health visitors, midwives are physically undressing babies, inspecting the babies, where before they may have been observing the interaction with mum and dad, and they would be observing rather than physically making those checks. I'd like to flag again around our ICON program, and I know Elaine is going to share some slides a little bit later around the ICON work. But the ICON really is about infants crying and making sure that parents are aware of the key messages and actually what to do if you feel you need to put the baby down and walk away. But I'll leave that to Elaine to come on in more detail. I would just like to move really just to some of the final steps, and I appreciate a very sort of time limited information I've got today, but we will disseminate this information, and we are really keen to develop more 7-point briefings. So where we've seen cases that come to our attention and there's learning on a multi-agency level, we'll make sure that that information is circulated across our partnership. Just for your awareness, in terms of when we do receive information through from organisations, we undertake that review, we look at that case, and that is all managed within our Safeguarding Practice Review Group, chaired by our designated Dr. Natalie Live, along with other partner representatives as well. Where there's learning, we identify that learning, and we make sure that the processes, our involvement of children, young people, if it's appropriate, and they're able to do that. I think someone's got their microphone turned on. If you could just turn that off, that would be really helpful. We all make sure that we've got parent engagement within the reviews that we undertake. It's really vital and important that we identify the views of parents and carers within our reviews, and explore that lived experience from them. All actions that we identify are managed through our subgroups. So we have dedicated action plans that we monitor and make sure that we assured that agencies are putting the learning into place. So that brings me to the end of my quick update really around particular cases. And I don't know, Natalie, if we've got any questions at this stage. If we haven't, I'll hand over to Hayden, who's going to take on the next slides.
I think Debbie Truitt had a hand up at one point.
By mistake, sorry.
Oh, okay, sorry.
No problem. Over to you, Hayden.
Okay, thanks everyone. I'm Hayden Rees-Jones. I'm the Policy and Development Officer for the partnership, and I support the audit processes as well as hidden harm campaign and other things as well. So, and today I'm going to talk to you about both of those. But first off, I'm just going to start off with the missing from home and care audit. So this is part of our deep dive audit process that we have in place, a multi-agency audit with partners. And for missing them from home and care audit, what we did was we had a look at the processes for when a child goes missing, how we audit those. We looked to quality assure the multi-agency working. We were looking at ideas, well, identifying areas for improvement as well. And also we tested the new missing from home and care joint protocol. Initially, when we started the audit, we had 4 cases which we were reviewing, but we extended that to a further 2 because of the introduction of the protocol to see what difference that had made. In terms of the joint protocol, that protocol is an agreed multi-agency protocol for and procedures for children, young people who go missing across North Yorkshire and the city of York. And to really make sure we have a common understanding, we use the College of Police in Missing People Authorised Professional Practice guidance, which defines a missing person as anyone whose whereabouts cannot be established and will be considered missing until located and their well-being is otherwise confirmed. All reports of missing people sit within the continuum of risk of no apparent risk absent through to high risk cases which require immediate and intensive action. When we look at children who run away, they might run away for various different reasons. They may suffer neglect, they may be subject of abuse, they may be challenged at home, or they may run away somewhere where they want to be with someone else, or they may be being exploited. In some cases, they may have been coerced into running away by someone, or there may be clear links to some sort of criminal exploitation. And really, it's a concern when a child runs away, because they then face the risks they face by young people are the same regardless of how often that they go running away and missing. Young children and those who run away or go missing often may be more likely to face long-term serious problems. So the type of concerns that they might experience is, in terms of anybody who goes missing, then obviously in terms of their income is a big concern. They might have no means of supporting themselves, which could lead them to more high risk sort of categories. They may become involved in drugs and alcohol or substance misuse as a result of going missing. There is also the possibility that they could be engaged in criminal activities. So they could become the victim of a crime, for example, through a sexual assault or exploitation, or they could be drawn into county lines and criminal exploitation, or involved in some form of sexual or criminal activity, which may be extended into their adulthood as well. There is obviously the issues about the impact on their physical and mental health and well-being. They might not have access to food that might be as nutritionally supportive, or might not have access to food at all, for example, and the deterioration in their mental health. They will obviously be missing from education in those circumstances as well, which is obviously going to impact on their future development there. They could go missing and become involved in inappropriate or abusive relationships, or something that is manipulative. They could also, they will also be homeless as well, which carries with them the fact that they don't have anywhere to stay, and could be stopping in very inappropriate conditions. So in terms of the findings of the audit, this is a summary of all of them. I'll just go into some of them in a bit more detail. The quality in recognising missing from home and care cases was strong at the point of the notification being made, and partners responded well. So assessment and planning, there's evidence of good planning and assessment with the missing from home and care action plans and risk assessments being present. There were some good examples of detailed return to home interviews that were carried out as well. We also had details of missing episodes of return from home were shared with the multi-agency child exploitation level 2 locality meetings, which enabled the information to be considered regarding the child's locations, etc. Interventions, partners demonstrated appropriate interventions as would be expected in relation to risk level attributed to each case and each episode. There was some strong intervention by the Community Safety Hub and coordinated of a large-scale community response to locate a child in one case, and in another one good engagement with the school nurse, which provided some opportunistic work as well. In terms of joint working, there was good joint working across all agencies and examples of timely information sharing. Children going missing from home and care, with the evidence being presented about the level 2 MACE meetings. In terms of impact and outcomes, children were discussed as did not have any further missing episodes as well, which was very positive. In terms of recognition for areas that we were concerned about or needed to change, there were some inconsistencies in terms of recording of specific dates, and also some return to home interviews were limited in exploring the risks, all of which will be looked at. There were opportunities missed to discuss some missing from home notifications as well, and it was difficult to evidence in some cases if no further missing from home and care episodes were as a result of interventions and support or the services, or whether this was just circumstantial. But obviously the work that has been done in terms of supporting the children and young people has been considerable in this sort of area. So in terms of future actions, here we've got recommendations that have been identified as part of the audit. Those recommendations have been considered by the Learning and Improvement subgroup to take forward as well, and updates will be monitored through the action plan that is controlled by the Learning and Improvement subgroup. We've produced a 7-point briefing on this. This will be made available very shortly. And the learning from the audits is obviously being shared across partners and in training such as this as well. There's also some other issues in terms of considering learning about the use of Operation Encompass, which links to domestic abuse notification sort of styles for schools in relation to missing episodes, reinforcing the messages about notifying of missing cases, and the use of the what's known as the MSPR daily download to be used as the consistent measure for when a missing episode had begun, because there was some confusion about when the dates for the missing was counted from. And again, clarification regarding the recording of information received from MACE locality groups within the child's health records, and some need to more robust in terms of the relation to the challenging injuries, as there was an issue in one case where it was felt that maybe a child protection medical examination would have been needed. So in terms of our next audits that we're looking at undertaking, those are, well, we're currently doing deep dive audits for children and young people who have been subject to repeated child protection plans. So we'll be looking at those cases over the next quarter, and then we'll be providing feedback in a future masterclass. Does anybody have any questions on that?
I don't think we've got anything in the chat bar as yet, Hayden.
Fab, thank you. I think it's me next. Is it Hayden?
It is, yes.
I am, super. Okay. Good afternoon, everyone. My name is Emma Phillips, and I work for the Safeguarding Partnership and lead on our multi-agency child exploitation arrangements. So I've only got 15 minutes this afternoon, and I wanted to give you a bit of an overview of some of the developments in the world of MACE. Many of you will have seen that on the 19th of March, we launched our MACE strategy and our BeAware Knowledge Hub. For those of you that haven't seen it already, I'm going to show you our launch video in a second. Pledge to partners on the webinar today. Please visit our website, have a look at the resources that we've got, and share it widely with your teams, your colleagues. And if there's any feedback, anything you'd like to see on there that isn't on there, please let me know. I'm going to give you a bit of an operational update, some of the key themes and trends that we're seeing around child exploitation at the moment across our districts. And then the third section, I'm going to talk a little bit around partnership information sharing. And I'm going to be supported by Superintendent Emma Aldred, who's prepared a video for us that will really help you understand the value of sharing that information with us. So fingers crossed this video will work. I'm really sorry, it seems some people don't have that video playing. It's playing on my screen, but obviously not some other people's. What we might do is, if possible, Natalie, if you could just put the link in to that on the website, then you can, for those of you who can't see it, can catch up and have a look at it. It's only a couple of minutes long, so hopefully, I think for some people it is and some people it isn't. Super. So apologies for those. I think Natalie's just put in the chat, there might be a bit of a time lag for some partners in terms of viewing that video. But if you go onto our website, it's on there. You can download it. More than happy that you put that on your own intranet websites, that you hyperlink that for partners to see it. Please share that far and wide. The strategy is also on there on the website. And we've also got some teaser clips as well for partners to share. So in terms of giving you a bit of an update around what we're seeing around child exploitation, in terms of what's going well, the meetings themselves, our district MACE level 2 meetings are going really well. since the lockdown restrictions have eased, we have seen quite a significant knock-on effect in terms of how busy it feels on the ground. Having said that, our meetings are really well attended using the virtual space, really good attendance by key partners, and feedback, especially for schools, are often reporting it's much easier to attend the virtual meeting. They've got less travel time, less time out of the classroom. That really helps. We have conducted a series of really well attended mapping meetings to really understand what that threat and risk for exploitation looks like within specific areas for groups of young people. We've seen some really good examples from our colleagues in trusted relationships, evidence of them building up really good relationships with the children and young people that they're supporting, which has actually really had a knock-on effect in helping us to develop significant intelligence around criminal exploitation. I've also had a particular case highlighted to me this month of one young person on the project who's not only turned his own life around and is no longer assessed as a risk of exploitation, but actually is asked to use his experience to help other young people going through a similar experience by joining North Yorkshire County Council's Restorative Practice Programme. Again, a really good example of symbolising the power of relationships in creating safety for young people. We've had some really nice examples of creative engagement during lockdown, so practitioners using different technology to engage with young people to ensure that we maintain our relationships that we have with them, and really good information sharing too. We've also developed our understanding for a lot of our complex peer networks and the increase in networks, not just across local boundaries, but also across district and county boundaries. We've had one particular mapping meeting that's involved partners from multiple MACE areas, including our colleagues in the City of York, to ensure that we're sharing information so that boundaries do not become an issue for us. In terms of emerging areas, many of you are probably quite mindful and have seen a bit of an increase in terms of intelligence coming from young people around the consumption of MDMA, of edibles and benzodiazepines such as Xanax, Valium and diazepam. We've seen a rise in young people having adverse experiences following taking them, and we're working closely with colleagues in public health, our drug and alcohol service providers, our police schools liaison team to understand how young people are gaining access to these substances, and then looking at what we can do as a partnership around preventative education. We've also seen an increase, as you might expect, possibly in relation to missing from home following the ease of lockdown, and the understandable impact of mental health related incidents as young people have struggled during the lockdown with family dynamics and other stresses. And this links into Hayden's Hidden Harm campaign that I know he's going to talk about in a minute. As I mentioned before, we're seeing increasingly complex peer relationships which are being facilitated through drug supply. We're finding it's often young people that are supplying to other young people, which sometimes can present a bit of a challenging dichotomy for us in terms of young people potentially being both a victim and a perpetrator with regards to exploitation. We're also seeing increasing concern around online risk to children and young people. The latest predictions from the National Crime Agency is that the number of children may have been significantly increased who've been groomed online during the pandemic, and now the risk is that they may go on to not only be groomed and exploited by those perpetrators, but at risk of meeting them in lifetime. In terms of next steps, we've made use of some really helpful analytical support from North Yorkshire Police just recently around some of our more complex interrelated peer networks and complex exploitation issues to help us understand the bigger picture, to understand the potential perpetrators around those young people. We are, over the next 6 to 9 months, conducting a review of our perpetrator process across the MACE arena to ensure that we're maximising our efforts to disrupt exploitation using the skills and the knowledge of the partners that we have around the table. We're continuing work with our drug and alcohol partnership to understand the threat from young people from substances. We'll shortly send out communications across the county as well with regards to our pilot for our new national referral mechanism panel. I'll be sending out formal communications around that, and we'll probably come and do a bit of a masterclass input on that once we've got some idea of what that looks like. MACE mapping meetings are really helpful as our engagement with our level 2. I know some of the partners on the webinar today already attend those and are really valued members of our partnership around that. For anyone who would like to become part of that or would like to find out more information, I've put the email address on the slide for you. Please get in contact with us. We'd love to hear from you. Okay, just the last 5 minutes of the presentation, I want to talk about partnership information sharing. It's really, really valuable to us. The information shared by professionals to police that's then disseminated out to wider agencies is really vital in our work to combat not just exploitation, but other areas of vulnerability for young people. It's really important that we identify safeguarding concerns for children and submit referrals. That's absolutely fundamental to our work. But we also need to understand not only who's been exploited, but those other 5 WH questions. So where is exploitation happening? Where are you seeing it in your districts? Where are you seeing people meet? Where are you seeing cars attend? Who's exploiting those children? We have a lot of intelligence and information often around children and young people themselves, around their peer networks, but we don't always understand who is it that they're at risk from? Who are those harmful adults around those children? Why are they being exploited? We know there's a lot of intricacies around grooming, around exploitation, and wider intelligence around the big why questions is really helpful for us. And how are they being exploited? Are they being picked up in cars? What type of cars are they being picked up on? Are they being encouraged to use our train, our rail networks, our bus networks? Again, this is all context that's really helpful. When is it happening? Dates, times, car details, really vital pieces of the jigsaw. We've seen over the last few months some really positive disruptions that have been that we've been able to put in place as a direct result of info shared by yourselves, by professionals working with young people, and I would really invite you to help us to promote this. Submission is easy. The form's on our website, it's on the front page, and you never know how small that piece of info might be, and that little nugget that you probably think might not be that important, but might be the exact piece of the jigsaw that we need. So if I can leave you with the words of our police superintendent, who at the time was a chief inspector of intelligence, but if I can ask for one thing for you to take from this presentation is please go onto our website, make yourself familiar with the form and share it across your teams so that we can start to effectively continue our disruption around exploitation. The next bit is a video, and this won't be made available to you outside of this. Please keep the content within yourself. It is restricted in terms of viewing. And it won't be made available on your website. And hopefully, I know some of you might get a lag, but hopefully you'll be able to see the video without too many problems. Thank you.
Right, good afternoon, everyone. My name's Elaine Wiley. I'm one of the 2 designated nurses for safeguarding children and children in care, working across North Yorkshire with all our health providers, but based within the CCG. And I just want to give you a very short presentation about ICON. Some of you may have already heard of it, some of you it may be very new. So what is ICON? Let's have a think. The aim of this session is to tell you about ICON, understand what it is, which is a programme designed to help parents understand and cope with normal infant crying and prevent abusive head trauma. I'm going to give you an overview of the message, remind you what abusive head trauma is, and then talk about how the message is going to be delivered. So what is abusive head trauma? It's a form of physical child abuse, and it was also previously referred to very much as shaken baby syndrome, which is a term you may be familiar with. Abusive head trauma, whether that is as a consequence of small but repeated shakes or one very, very large and dramatic shake, can result in very catastrophic injuries for small children, including brain injuries. We get bleeding in the brain, bleeding behind the eyes, and bony injuries. And the fractures we see can be as a result of the baby being gripped hard and shaken, as a result of the head being banged against something, or as a result of the long bones of the arms and legs being flailing around, and we get little chip fractures as a consequence of that. It is the most common cause of death or long-term disability in babies. If you look at those children who die as a consequence of abuse or neglect, the predominant age is below 3 months, and the most common cause of death is abusive head trauma. Depressingly, particularly over the last year, we've seen an increase nationally in abusive head trauma, and that's been reflected in North Yorkshire, really thought to be as a consequence of families being locked down together where there are already some pre-existing tensions. So ICON is about talking to parents and carers about crying and how you cope with it, because we know that a number of cases of abusive head trauma are triggered by infants crying. Those two links at the bottom of the slide. The first one takes you to the ICON website, really worth a look, whatever. And that particular video is a video of a BBC One Inside Out programme that we actually filmed up here in Harrogate. And that particular clip is a paediatric neurologist talking about the mechanism of abusive head trauma, what it actually does. The second clip is an incredibly moving account of what abusive head trauma can leave children with. This is a little boy who was shaken at birth by his father. He lived until he was 14, and this story is narrated by his mother. If you ever needed a rationale for supporting ICON, that story is it. Ellis's mum, May, is one of our parent advocates for ICON and is incredibly motivated and supportive. We know, sadly, that some babies are more at risk than others. Boys, babies under 6 months, babies who are born early or who have low birth weight, and babies where there is previous family involvement with child protection services. So who shakes? Well, statistically, we know that 70% of perpetrators are males, either fathers or male surrogates. One of the key triggers for babies being shaken is crying. Any one of us that have lived with a baby who has cried excessively and for no apparent reason will recognise how that feels sometimes. It feels like you're being driven to a cliff edge. It's very difficult to be cool, calm and collected in the face of a young baby crying for apparently no reason, particularly when you're tired, when there are other things going on for you. There is a very, very clear relationship between infant crying and babies who are then shaken. I can show you the next two slides. This slide is cases of abusive head trauma. The blue line, the top line, is where there is no apparent explanation given by the parent or carer for the shaking. The red line is where crying is cited as the reason for the baby being shaken. And you can see that the lines, the shape of the graph is closely similar. You see that the peak is between 8 and 10, 12 weeks. Now let's look at the peak of normal crying. This was first described by an American paediatrician back in 1990. And his research showed that all babies will start to cry more at around 2 weeks. The amount of crying increases and reaches a peak at around 2 months or just slightly after that. It then reduces down by the time the baby's between 4 and 5 months. The amount the baby cries is very dependent on each individual infant. But what we know is that crying is normal. The baby may be absolutely well physically, be fed, warm, comforted, cuddled, and may still cry. And there is no reason for it. Does not mean you're a bad parent. There is no apparent explanation. This is normal infant crying. Because of the strong relationship between crying and abusive head trauma, any prevention programme really needs to focus down on helping parents manage that normal crying process. Evidence, and there is a vast amount of evidence around this, it is very much evidence from the States and Canada, but there is an increasing body of evidence from this country as well. And the evidence shows that coordinated approaches to a prevention programme can be successful. You can reduce the incidence. Bear in mind, abusive head trauma is 100% preventable. So a coordinated approach can be successful. The ICON programme was developed from this very firm evidence base and focuses on helping parents understand why their baby might be crying. In other words, there might be no reason, and supporting them through it. We're not saying to parents, you have to stop the baby crying. What we're saying to parents is the baby will cry. You may not be able to stop it, but there are ways of coping with that. It's a quite different approach. So what does ICON stand for? Well, ICON, the sort of strapline is babies cry, you can cope. And in one of the first lots of evaluations that was done down in Hampshire, where this was first introduced, what parents fed back was, when the baby was crying and they were feeling really quite stressed, the mantra that kept going round in their heads is, babies cry, I can cope. It's a really positive message. So the acronym I stands for infant crying is normal and will stop. You get that increased peak of crying from 2 weeks of age, and it may get more frequent, rising to about 8 weeks of age, and then it will start to decrease. The C stands for comfort methods are available and can sometimes soothe the baby. It's encouraging parents to think about the bog standard stuff, hungry, tired, needing a nappy change, and also to think about what works for their babies. We know that some babies respond really well to noise, such as a hoover or a television or a radio or even a washing machine. Some like being pushed out in the pram, some like going in for a ride in the car. They don't always work, but some methods sometimes soothe. The O is the important one. It is okay to walk away from your baby if the baby is safe and the crying is getting to you. Take time out. Stops you from actually tippling over that cliff edge. We're not advocating a long period of separation. We're just saying walk away for a few minutes. Do whatever you need to do to calm yourself down. A few deep breaths, bit of mindfulness, make a cup of tea, whatever. Then go back to the baby. And the N, never ever shake the baby. It can result in catastrophic injuries or death. ICON, really simple, 4 key points. So, one of the things that came out from the evidence base is that for any successful programme, the message needs to be given and given repeatedly at key points, touch points, throughout the baby's early life. So our touch points are, during pregnancy, our health visitors and midwives are starting to talk to parents during pregnancy about ICON, about the fact that babies will cry. So you're starting to prepare people already. Following delivery, this is done by both health visitors and community midwives after the baby has been born, reinforcing the message that they got at antenatally. Sorry, I've jumped one. What I should have said was following delivery. This is one of the most important ones. Before parents leave the hospital with their new baby, they will be given the ICON leaflet, and that will be talked through with them by hospital midwives or midwifery staff. Ideally, that is the point where both parents are around. That's been a challenge during COVID, but hopefully we're returning to a more normal situation now. So both parents get that message, then reinforced at the postnatal visit by community midwives, reinforced at the new birth visit by health visitors. In North Yorkshire, we're really lucky that our health visiting service will send a standard text to parents by phone at about 3 weeks, basically reminding them that the infant crying may be starting to increase by now, reminding them about ICON. All our GPs do 6-week baby checks, and again there is a template available for them to ask parents about how they're coping with crying. It gives them a really good opportunity to explore some of that work with families. Those are the points that are given by health. However, we all have a role to play in supporting parents. So how can we do that? Positively trying to engage with male caregivers, helping every parent or caregiver understand that crying is normal, and it is normal to feel like you're at the end of your tether. Reassuring parents and caregivers that babies aren't doing it on purpose, and support them in coping with their own emotions and stress. Reminding them about safe sleep messages. Why that's important is where we say it's okay to put the baby down. You need to put the baby in a safe place, and we would want to reinforce those messages. They are described in the information leaflet. And then encouraging parents to share that information with anyone else who looks after their baby, because we know that it isn't just parents who shake babies. The website is the most fantastic resource. Tons of stuff there for parents, for professionals. All the resources, leaflets, posters, all sorts are available on the website. Importantly to stress that there are also easy read leaflets for parents with learning disabilities. Those were developed by a particular company with service user support. Also, that little icon on the top right hand where it looks like a pair of earphones with a B is called a browse aloud function. What that will allow you to do is to select some writing on the website, select a language, and then the browse aloud function will automatically read that bit of text aloud in whichever language you've selected. That's really helpful. Tons of stuff on social media. The social media work is very much aimed at male caregivers, and we know from the social media analytics that that's where it's reaching. So please follow us and support the work that all of us can do around preventing abusive head trauma. I'm sorry if I've talked really fast, but that's quite a lot of information to get over in a really short space of time. Again, happy to, I'll put my email in the chat line, so if there's any questions, please come back and email them to me. I'll happily take any questions as well, if anybody wants to put them into the chat now.
I'm very conscious that we haven't got much time, so I'll just outline the Hidden Harm campaign in terms of what we're looking for as a partnership. There is going to be some supportive material at the end of this, which you'll be given access to very shortly, so that'll give you more in-depth knowledge. Basically, when we talk about hidden harm, we talk about things that are not viewed by professionals, which could impact on the mental health of a child exploitation. It could be online abuse, it could be domestic abuse, or it could be substance and alcohol misuse as well. Possible indicators that you might sort of see, some warning signs. Think about, where is the child? You know, if a child is seen in the middle of the high street, you know, maybe you're a shopkeeper or something like that, or a taxi driver, and you see a child in the middle of the high street. Now, there's no reason for a child to be there during the week, so they should be at school. So that might be a possible indicator. How are they when you have contact with them? You know, they may be reluctant to talk to you. There could be, you know, they may have you know, express some sort of concern. There might be visual signs. You could be looking at things like marks and scar or bruises. If they're engaging in self-harm, or maybe have suicidal thoughts, you know, that there might be marks and scars, that might be a visual sign there. Or it could be fabricated illness, you know, as a child being presented as being ill, or if it's a child whose family comes from certain countries, a lot of them within you know, like Egypt or African countries, then there's a possibility, if they're talking about coming of age events, that it could link to female genital mutilation, or FGM, if you've heard of that before. You could look for unusual behaviours, so things like poor social skills, becoming withdrawn, aggression, etc. Or maybe they have issues with attention. Maybe they're not paying enough attention, or being overly attentive in terms of things. They might be engaged in risk-taking behaviour, such as drugs and alcohol. They may be changing friends, which, you know, could be an indicator of concern as well. Or they might have inappropriate, harmful or inappropriate sexual behaviour might be displayed, which is not in the scale for the age group that they're at. All of these things are potential behavioural issues. Other indicators which we could have is about the child's mental health. They could be expressing anxiousness, sadness, or being angry. They could have problems with the self-worth. Maybe they're not feeling confident. They might be avoiding contact with professionals, or there might be an over or lack of emotion. So maybe things are, you know, upsetting a child much more readily, or they may seem to be overly resilient to some issues. They might be linking in with extremism if they're coming out with different sort of like political views, that sort of thing. or again linking to illnesses if they're frequently absent from school, or if they still do online stuff, then those sort of activities. What we want people to do really is, if you have a concern, obviously you can visit our website for the campaigns page for information about hidden harm, but we also have a page on what is hidden harm as well. But safeguarding is everybody's responsibility. Consider, are the changes that you see in a child, are they normal and age appropriate, or is it something that you're still concerned about? Think about what do you really know about the child, and particularly be professionally curious. If you have a concern, try and find out more about why you have those concerns. Follow your organisational procedures, and above all, as with our hashtag is, tell us your concerns. So we do have coming up a new podcast which we've done, and we've had input from various partners across the county. So if you want to know more, then that is coming soon. And is there any questions about the Hidden Harm campaign? Okay, just a couple of last little bits in that case then. Don't forget to sign up for our e-bulletin, which is available from our website. Don't forget to also follow us on Twitter, and also visit our website, which is safeguardedchildren.co.uk. We also are now on Facebook as well, and that's another avenue that you can find us. And don't forget about our next masterclass, which is on the 28th of May. And these are the subjects that we're looking at here. So it's exploring the learning outcomes of the child suicide prevention task and finish group. And if you've got any questions, please get in contact with us. Thank you for listening.